Hello, my name is Dr. Eugene Gabinelli, and I'd like to discuss LASIK surgery with you. So LASIK surgery, as I'm sure you have already heard, is a very commonly performed procedure which reshapes the cornea and decreases the dependence on glasses and contacts. LASIK has been performed in the United States since 1995, and I had the fortune of being part of the Atlanta study group in the initial FDA study, and so began performing LASIK here in Atlanta in 1995. Now LASIK has progressed dramatically, and where we used to create a corneal flap with a blade instrument called a microkeratome, for the last 6 years we have performed LASIK using a femtosecond laser to create the LASIK flap. Let me review briefly what the LASIK procedure accomplishes. So the cornea is the very front surface of the eye, the first structure that the light encounters when it hits the eye, and is the strongest focusing structure in the eye in terms of focusing the light clearly on the retina. So a patient requiring LASIK needs a slight change in their corneal curvature to make the light focus more clearly on the retina. In the case of nearsightedness, we make the cornea flatter, and in the case of farsightedness, we make the cornea steeper, utilizing an excimer laser. This is a two-part procedure where we create a flap approximately 1/5 of the corneal depth into the cornea. We elevate that flap, and then we place the excimer laser treatment and then replace the flap. The utilization of the LASIK flap allows us to have excellent patient recovery with excellent comfort and vision within the first couple days after surgery. So to review, modern LASIK, as we perform it here at Georgia Eye Partners, involves the use of a femtosecond laser to create a corneal flap in the front portion of the cornea, then to place an ablation using an excimer laser to either flatten or steepen the cornea, and then the flap is replaced. And there's a rapid recovery following LASIK. There is a very small chance of some glare and halos, particularly with nighttime vision, but utilizing modern technology, including a customized laser beam, which is devised specifically for each patient's eye, and utilizing the femtosecond technology to create the LASIK flap, these complaints are far diminished from the early years of LASIK. It is important for any LASIK patient to understand that they have a small chance of requiring a tune-up procedure. In our experience, this has been about 3%, so 3 eyes out of 100 would require a second procedure to fine-tune the initial result. Now, is LASIK the only procedure to reduce or eliminate the eyeglasses and contacts? No, it is not. There is an additional procedure which also utilizes the excimer laser, which is called PRK, which stands for photorefractive keratectomy, and this same procedure is also called ASA, which is advanced surface ablation. So the PRK procedure utilizes the same excimer laser to perform the same corneal flattening or steepening, but instead of creating the LASIK flap, we simply remove the outer layer of cells and place the laser beam on the surface of the remaining cornea. Now, the long-term vision between LASIK and PRK is equal. However, the recovery following the PRK procedure is more delayed than following LASIK. A patient will require a Band-Aid contact lens over the surface of the cornea for 5 days while the outer layer of cells heal, and then that is removed, and the patient will continue on their eye drops for about a month. With LASIK, the eye drops last only about a week, and the visual recovery is quite rapid within the first few days. With PRK, the eye drops will be tapered over a month, and the visual recovery is more delayed, with patients knowing that they've had a big improvement in vision, but not arriving at their final vision until perhaps 2 or 3 months following the procedure. If you have more questions about laser vision correction, which would include LASIK or PRK, our staff would be very pleased to speak with you about this, and I look forward to speaking with you in the office. Thank you.